Welcome back. Today we're going to do chapter 3 of Exploring Medical Language. We're going to look at directional terms, positions, and imaging. This should be a bit of a shorter lecture than the last one. Anatomic position is the position that all bodies will be in when we are describing them. So this is the way that the body should look. Standing, feet just a little bit apart, palms facing forward with the arms at the sides. It's extremely important that you always reference the body in this position, because if the palms are facing backwards, then you're going to have your medial and lateral sides mixed up, and then people aren't going to be able to understand what you're saying, or they'll think they do when you're saying something else. So anatomic position, you should stand up right now, put your feet together, put your palms facing forward, and consider what is the right, what is the left. You also want to consider that when you're looking at your patient, they are a mirror image of you. So their right-hand side is on your left-hand side, and your left-hand side is on their right-hand side. There's a lot of terminology in this chapter, but some of the combining forms that we're going to see are antero, meaning toward the front, dorso, meaning toward the back, postero, which also means toward the back, proximo, which means closer to the site of attachment. So if you're looking at the arm, the elbow is proximal to the wrist. It is closer to the shoulder where the arm attaches to the body. Disto means farther away from the attachment. So the wrist is distal to the elbow. So we use proximal and distal in terms of the arm and the leg, and we can also use it in terms of the intestines from the starting point to the ending point. Lastly, we have supero and infero. Supero is superior, meaning toward the top of the body. Infero means inferior, or will be turned into inferior, meaning toward the bottom of the body. So the head is superior to the shoulders are inferior to the head. Some combining forms that we see with diagnostic imaging are radio, meaning X-ray, or pertaining to radiology. Sono, which means sound, so like ultrasound would be a sonogram. And then tomo, which means to slice, cut, or section. So we do sectional images with MRI and CT scans. Some of the prefixes we'll see are bi, meaning two, and uni, meaning one. If you were to see tri, that would mean three, quad would mean four, so multiple prefixes that indicate a number. Some suffixes, these first line of suffixes, ad, al, ic, and ior, all mean pertaining to. So last time we talked about multiple terms that mean the same thing. Well, here you will get used to what terms are going to use which suffix, but they all mean pertaining to. So if we said superior, it would be pertaining to the above, so something that is above. The word graph can be used in two ways. One, as the instrument to record. So a radiograph machine would be the machine that records radiographs, which are X-rays. You can also use graph as the actual record. So when you have a physical X-ray, that is your radiograph. So it can be used to say the machine, the instrument, as well as the record. Graphy is the process of recording. So radiography is the process of recording radiographic images or X-ray images. Directional terms are going to give us an idea of where in the body we're looking, and it can allow us to say where things are in relation to one another. So this structure is where in relation to another structure. So cephalad means toward the head, and caudal means toward the tail. So the tail in this case would be the tailbone or the sacrum or coccyx, so at the bottom of the pelvis. We only use cephalad and caudal when we are discussing the actual torso, not the arms or legs. Distal and proximal are from those word roots or the combining forms disto and proximo. So distal, farther away from the attachment, proximal, closer to the attachment. So we're using those for the arms and legs and the digestive system. Superior versus inferior. Superior means above and inferior means below. So you might say, are those the same as cephalad and caudal? And in the torso, yes, they are. Superior would be equivalent to cephalad, inferior would be equivalent to caudal. But you can use inferior for other parts of the body as well. Ventral versus dorsal are going to be similar to anterior versus posterior. So ventral and anterior mean toward the front side of the body. Dorsal and posterior mean toward the back side of the body. Anterior and posterior are used more commonly these days. Ventral and dorsal used to be the common terms, but they're slowly sort of being replaced with anterior and posterior. And this last one, antero-posterior, or A to P, means from the front side to the back side. So there are some x-rays that are taken A to P, meaning the patient is facing the x-ray tube when the x-ray is taken. So the rays are going from the front side of the body through the back side of the body. There are two ways that we can sort of imagine that we are sectioning the abdominal pelvic cavities. So one of these is abdominal pelvic regions, which you can see here. So there are 9 different regions. The umbilical region is in the center around the umbilicus, which is the belly button. On either side of the umbilical region, we have the right and left lumbar region. Lumbar is the term for the lower spine. Above the umbilical region, we have the epigastric region, and those are sided by the right hypochondriac and left hypochondriac regions. Below the umbilical region, we have the hypogastric region, and the sides of the hypogastric region, we have the right iliac region and the left iliac region. Abdominal pelvic quadrants are larger than the regions, and we have 4 abdominal pelvic quadrants versus 9 abdominal pelvic regions. So if that same picture was here, instead of being cut into, that's horrible, but I'm not a great drawer. Instead of being cut into 9 regions, the abdominal pelvic quadrants would be 4 regions. So we have the right upper quadrant. Let me change this color here. So the right upper quadrant is here. You may be thinking that's the left. That is your left. That is your patient's right side. Then the left upper quadrant is here. Then you'd have the right lower quadrant. Wow. Please do not show this all over the place. This is for educational purposes, not artistic purposes. So right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So these are used pretty extensively these days. The regions are more specific, but the quadrants are easier to remember and distinguish. We can also describe the body using different planes. So planes are slices through the body. We use this for imaging of the body, so radiographic imaging, MRI, CT scan, and we can also use it for dissections and for considering locations of things, of structures in the body. So an axial or transverse section would be a section that it slices the body into an upper portion and a lower portion. So it goes horizontally across the body to an upper portion and a lower portion. A coronal slice slices the body into an anterior portion and a posterior portion. So imagine it's a line going through your ears, down through your shoulders, your hips. So you have this anterior portion of your body and a posterior portion of your body. The sagittal plane or a sagittal section divides your body into a right portion and a left portion. Mid-sagittal is directly in the middle, so that you would divide the body into equal halves with a right side and a left side, so straight down through the nose. A parasagittal section is any other sagittal section that is not in the midline. So the midline is an imaginary line that separates the body into two equal halves. So that would be your mid-sagittal plane is in the midline. So anything not in the midline that is cutting into a right half and a left half would be considered a parasagittal section. We have multiple different positions of the body that have names. And when we're doing procedures, different procedures require patients to be in different positions. So there are names for these positions to make it easier for you to understand what the physician is looking for when they're asking you to put a patient into a certain position or prep them for a procedure. So some of these are the lateral recumbent position, which basically just means the patient is lying on their side. So you would say right lateral recumbent if they're lying on their right side, left lateral recumbent if they're lying on their left side. Orthopnea position is when your patient is sitting up completely upright or leaning forward. So we put patients in this position when they're having difficulty breathing because it makes it a little bit easier for them to move air in and out of their lungs. The prone position means a patient is lying on the table face down, versus supine position is lying on the table facing up. So you're facing the ceiling. Trendelenburg position is lying on your back on a tilted table with your feet above your head. So those are just some of the positions that we ask our patients to get in. There's another position called the semi-prone position, which previously was called Sims position. In this position, the patient is sort of half on their side, half on their stomach. So they're lying on their side, but their top leg is lifted, top arm is up, and the bottom arm is pulled back parallel to the body. You may wonder why they would change the name of a term. If it's Sims position forever, why do we have to change it? Well, generally, we're moving away from the use of eponyms. So Sims position was named after the man who sort of discovered that position. And so it's an eponym. It doesn't give us any actual description, so all you have to memorize it. Whereas semi-prone position is telling you semi, which is sort of or half of, prone, which is laying on your face. So you're like almost laying face down, but not quite. That gives you a lot more information about the position than just saying Sims position, which is named after the dude who discovered it. Also, Sims was not a great guy. He figured out all of these different positions using enslaved women and without using anesthesia, and that was not a good thing. So if we use his name, some people might think that we're disregarding the suffering that he had caused. Another example is Crohn's disease is more effectively called regional enteritis or regional ileitis, and that denotes where the inflammation is. Is it in the colon or is it in the small intestine? So enteritis would be the colon, ileitis would be the small intestine. Some diagnostic imaging terms. A radiograph, as we discussed, is a picture, like an X-ray picture of the inside of the body. A sonogram, sono meaning sound, gram meaning picture. So a sonogram is an ultrasound using sound waves to create a picture. Those are both built from word parts. Some that are not built from word parts, which require memorization, are fluoroscopy, which means the study of moving structures. So fluoroscopy is sort of like a live moving X-ray where you can see inside the body where things are moving. Magnetic resonance imaging is creating images using large magnets, very strong magnets. The benefit of MRI is that it does not use ionizing radiation, so it doesn't have that potential to cause cancer with looking inside the body, like a CT scan, computed tomography, which is computerized sections of the body, which does use ionizing radiation. However, MRI is very good at looking at soft tissues, whereas CT scans are very good at looking at denser tissues like bone. To reiterate, why are we using all of these very specific terms? It is to prevent medical errors. So directional terms will tell you which way to go when looking for a structure or a growth. Spelling is extremely important. We'll see in the next slide or so, a few slides, the difference that one letter can make. Abbreviations, we have accepted abbreviations and then abbreviations which are not recommended to be used. And then definitions, we want to know what do all these terms mean. So I just want to reiterate, every time you describe a patient, they are standing in anatomic position. When you are looking at them, their body is a mirror image of your body. So your right is their left, and their right is your left. It's important that you avoid saying right when you mean correct. I've had to learn that while teaching my children how to drive. They'll say, am I turning left? And I'll say right. And then they'll say, I'm turning right. And I'll say, no, you're turning left. That's correct. So instead of saying right, say correct. If you want to indicate the patient's right, then you would use the word right. Here we'll see a couple of words where a single letter completely alters the meaning of the word. So this first word, abduction, means moving a body part away from the midline. Abduction. Adduction means moving a body part toward the midline. So if you abduct your arms, you lift them away from your body. And if you adduct your arms, you bring them back down toward your body. When I was learning these terms in school, we pronounced them abduct and adduct, which I still do in my head to this day to keep them separated in my mind. The term phasia here means to eat or swallow, where phasia with an S means speech. So just that one G or S totally changes the meaning of the word. So you want to be very, very careful with your spelling. We have to be careful with abbreviations. Abbreviations can be wonderful. They can help us save time when we're speaking, especially if there's an emergent situation. They can help us save time when we're documenting. However, there's usually a list of acceptable abbreviations, and there's a list of abbreviations that should not be used. On page 730 of your textbook, there's an abbreviations appendix that gives you a list of error-prone abbreviations. So these are ones that you should stay away from and just use the accepted abbreviations. When you get a job, Your place of business should have an accepted abbreviations list that you have to become familiar with, so everybody is honestly speaking the same language. When in doubt, look it up. Never, never, never feel embarrassed about having to look something up. It is much, much more important that you write and say the proper thing, or that you understand what the physician is telling you instead of thinking that you know it and doing the wrong thing. When I had my shoulder surgery, I was joking with the doctor and said, it's my right shoulder, not my left shoulder. So he took a marker and he wrote, not this one, on my left shoulder in order to keep himself from cutting open the wrong shoulder. So very, very important that everybody's on the same page and we know what's going on. I'll see you next week.